some of the ground. Please mute yourself during the session, and you can unmute and ask questions during the Q&A session, or post your question on the chat box. I'm Anita Sarvade, BVI Floating Club member, and I'm MC for today's session. BVI Floating Club welcomes all of you for the wellness program. Today's subject is Care Your Eyes. Eyes show off the strength of your soul. Vaidyu Narayana Hari. We always treat doctors who gives us second life as God. Today, we are blessed to have Dr. Bharathi Chandrakanth to give us insights on how to care your eyes. As all you know, as part of our tradition, we start our session by reciting Gayathri Mantra. Now, we request Srimati Savita Ratnakarji to recite Gayathri Mantra.
Om Bhurbhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yona Prachodayat. Om Bhurbhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yona Prachodayat. Om Bhurbhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yona Prachodayat.
Thank you, Savitaji. You brought the much needed divinity and grace to the wonderful evening. Let us do 1 minute silence to pray for the speedy recovery of our beloved Mr. K.V. Rao, one of our BVI visionary. Thank you, everyone. With no further delay, now we invite BVI Floating Club President, Mr. Manohar Bodkeji, to deliver welcome speech. Over to you, Manoharji.
Yeah, thank you, Anita-ji. First of all, namaskar to everyone. BVI Floating Club completed successful 1 year. It's been 1 year. We have been working together to deliver value addition to our community. I would like to congratulate my entire board team, and thank you, leadership, for supporting us. Whatever we are doing, it's all because of your support. And I'd like to thank you, Bharati ji, for accepting our invitation and here for delivering today's session. Our BVI founder couple celebrating birthday this month. We would like to wish belated birthday wishes to our founder couple. Sir, happy birthday. And our president, National President Satish Jadhav ji, he is here. Welcome, Satish ji. Been watching all the activities which is happening across nation under your leadership team. It's amazing to see. Every month the activities are published. I encourage every one of Bhavsar to look at what is happening. It's a very big effort. People are spending a lot of time in doing community services, meeting one another, doing area conferences. So one of the contribution BVI Floating Club is doing is to provide such opportunity for the people who are not able to meet physically. And we are trying our best to bring more and more people who are living in abroad and living in places where there is no BVA presence. One of the asks for all Bhavsar members is to connect us with your friends and families who are living in abroad or in a different places in India, so that we'll come to know each other. And ultimately, the goal is to together we can do some value addition to our community. So without further delay, I would request Satishji to deliver just a quick address this meeting.
Thank you, Mr. Manohar, and all the participants, and especially all the floating club members and youth club members who felicitating or facilitating this seminar from our own Bhavsar, Dr.Bharathi. Really, it is one of the initiative PUF Floating Club has started across the globe, wherever our Bhavsars are available experts, so that we can connect Bhavsars to Bhavsar. Wherever field, I mean, I think we had some financial advice, and we had some other seminars as well. And mostly next month we'll have one more seminar on how to get admissions in the other Europe and American universities. So that's really good, very good initiatives from the Floating Club and Youth Club together, and it's going there. It will help a long way to all our authors. And as Manohar rightly mentioned, I also communicated in all our groups. This is one of the platform where people across bosses across the globe can connect together, though they stay away from India, stay away from cities, or they're busy in their professional life, but still be connected and be in the mainstream, right? So connected, and they know what if they connected through this group, this floating club, they come to know what is happening across India, across the clubs, and what are the services we are providing. Who of the Bhavsars will come to know. So I encourage and recommend all Bhavsars who are joined here, wherever your Bhavsar relatives, friends, colleagues, whom do you think that okay they should be part of this group, please recommend them to join. So you can share the number with Manohar and us, so that we can add them to this group. So I wish you all the best for this session. Thank you, Manohar, for the opportunity.
Yeah, thank you, Satishji. Anita, over to you.
Yeah, thank you, Satish ji. And right now, let me take the privilege to introduce the speaker. Dr. Bharathi Chandrakanth is a consultant ophthalmologist from Amrit Hospital, Shimoga. She has done her MBBS, DO, and MS from JJM Medical College, Davangere. She is working in her own setup, Amrit Health Complex, Shimoga. She has around 25 years of practice. She has done charitable work like free eye camps in Megawna Hospital, Lions Club, Rotary Club, Friends Center, etc. She used to conduct free health checkup camps at Tulja Bhavani Temple, camps for Yoga Center. Her husband is also a doctor, a physician, Dr. Chandrakanth, who is also working in the same setup. She has 3 kids, and all of them are in the medical field. All of them are doctors. Now, let me take the privilege to invite our beloved doctor to start the session.
Thank you, Anita. Thank you. Namaste to everybody. It is my pleasure to join the floating club. The word itself is so fascinating, that floating club, the word itself is so nice to hear only. And BVI, as it started in Shimoga, I am the member of BVI. First point, I want to say my namaste and thanks to the founder president, Sri Narendra Tatuskar, who asked us to join and who was very close to our family, our members here. And then I want to say my thanks and respect to Sri Satish M. Jadhav sir, BVI president of national president, and BVI Foundation Trust Chairman Sir Kiviro. I heard his health issues. I always pray about the fast improvement of his health and all. The floating club of 21-22 team is really acting very nicely. I don't know how it acts, how it works. And I came to know only after hearing about this through Anita Sarvade. Anita was my close friend during my PU days, and we used to enjoy our mathematics and chemistry in the first bench. She used to sit in the center first bench. I used to in the right side first bench. She entered the engineering field. I entered the medical field. Since then, we are together, almost together mentally, not physically. And I really appreciate her contribution in these social aspects also. She is a professionist by engineer, and she is work. These such people are really model. They say I am doing very well, but see, so many people like you people doing so nice works in the society, need not be physically, need not be approaching each and everyone in the society, but in this aspect you are encouraging, you are uplifting our family member, our community members, you are encouraging in this way. So really this team and who are really in this session are say great thanks to these people who are making a awareness in the people, so that they can, such people are there in the society. Our community people are working so hard, are in the so good position, and so that they can become model to others also. This is one way of inspiration to the society. Thanks, Anita, once again. And floating, can you hear, please, sir? Or Anita, Manohar,
Yes,
sir?
Then,
That floating club 21-22, I should say thanks to Sri Manohar Rao Bodke, sir, Dr. Praveen Kumar Bodke, and Srimati Anita Ratna Sarvade, Srimati Sri Ratnakar Undale, and Sri Basant Rangdal, our own city Shimoga candidate, and Sri Ashok Basutkar, Sri Lakshmish Mahadikar. Thank you once again. It's my privilege to be a part of BVI at this evening, beautiful evening, this Shravana Masa, end of Shravana Masa, 27th of this August. And so nice, so very month itself is very extremely memorable month and extremely good day, because I am with you people this evening. The topic itself, Anita say, it is a health session, a wellness session regarding the not the property wellness session. The topic is so nicely planned, so that everybody earned everything you have, but health is wealth. That is the prime aspect, and the prevention is better than cure. That is the topic today to be discussed, regarding, especially regarding my as a doctor, my main topic, always I speak with my patients, my consultations start with prevention is better than cure, and health is wealth. We have property, we have a helicopter, everybody has the property, swimming pool, everything. But if there is physical fitness is not there, if he is not able to move, if he is not able to eat, if what he earned, what is the use of getting that much of property and all? That's not the thing to be, that is to be neglected. Health is so important, so important. The earning and getting fame is one side, 50%, other 50% is health. In that health, today as an ophthalmologist, I have given the topic by Sarvade Anita in a beautifully branched side, so that regarding the eye health, the main thing is prevention and the important diseases which come across the all age groups, and how to handle them and how to cure them in a best way, and how to get a good treatment to the patients. That's what prevention is better than cure. I am repeatedly telling. Everybody know that health, the eyes are just working like two cameras of our of the body. Eye has lens. Just in general, eye has lens, cornea, and behind that vitreous. Still go back behind that is the retina. It is a light sensitive area. So common eye diseases in the younger age group, middle age group, and good old age group. We can classify like that. In middle age group, commonest complications or common eye ailments are cataract, glaucoma, diabetic retinopathy, vitreous hemorrhage and all, and central serous retinopathies, retinal detachment, and floaters, seeing the floaters in the eye, and trauma, refractive errors, so many problems. In younger age group, trauma is very common, accidental trauma. Second one, they might be suffering from the congenital cataract or congenital dacryocystitis and cystic infections and all, dacryal blockage of the canal. I will explain. And the children may have congenital glaucoma, majorly refractive errors in the younger age group. They will be having nystagmus, squint, and retinal tumors, etc. In old age group, all are degenerative problems. In a commonly noticed the eye diseases are cataract. You might have heard so many times, pore, they call it as motibindu or pore cataract. What is cataract? Cataract is just the opacification of the eye lens. Eye lens is totally transparent, and it is of just a piece-like structure situated behind the cornea, allows the light to pass through it, and we are getting the image which falls over the retina. Everybody knows that. But in some conditions, what happens? Usually age-related. This lens will become opacified. Lens proteins are become hardened, and they will produce the opacification, just like a door. That the light is not passing through the cataract, and it is naturally, we are not getting the image over the retina. So what to do? The lens should be removed. That is easiest way of treatment. Okay. Why it occurs? It is age-related phenomena, I told you. Cataract, just like how you are getting the gray hairs, how you are getting the wrinkles of the skin, just like that, so many will have at the age of 40, 45, 50, 55 in Indian scenario, Indian environmental climate changes. But it can occur in the developmental ages also. Congenital cataract, by birth also the baby will have the cataract. And during the developmental stage also, in the intrauterine stage only, the baby will be having, newborn will be having the cataract. Traumatic cataract is a very, very complicated within 24 hours. For example, the patient had a hit or a cricket ball trauma. Early morning, if we had a trauma because of cricket playing, next day morning he will come, or in the evening he will come totally cataractous lens because of protein denaturation and disinfect. It will be liquefied and become hardened. It will produce the cataract. Just in the morning, they will come with the cataract. Traumatic cataract, cricket ball injuries are very, very common. The cataract might be because of as a part of the complication of the diabetes mellitus, diabetic cataract. A patient might be patient on the steroid for a longer time as a complication of the steroid. I will come to that complication of steroids and diabetes mellitus. Radiational, patient is on some of the radiotherapy for any cancer and all, he might be as a complication of the radiotherapy. Industrial hazard, he might be working in some industries and exposure to the ultraviolet rays or solar eclipse or infrared rays. These things may produce the cataract. So easiest way, this is the easiest, there's the pros and cons of some surgeries. The topic is that in that aspect, this cataract surgery is a so simple surgery. From Charaka Shushruta only they used to do pressing of the cataract, so that used to press over the cornea. The lens used to fall back in the vitreous. Couching method they used to call it as. Since then, the unscientific methods were used, but recently, since 100 years, we are doing so nice scientific way of surgeries. Yes, entering, and you might have heard the phacoemulsification is the boon to the surgical field. Just entering the cornea with 2 millimeter and entering into the lens area, sucking the cataract, comes out. I have to keep the foldable IOLs. You might have heard the foldable IOLs are injectable IOL. IOL is intraocular lens. Removing the cataract, keeping 21 diopter measuring IOL in its place. Naturally, patient will have normal vision within 1 hour after surgery. Without any injection, they are doing surgery in the higher centers. Without any local anesthesia, they are doing surgeries in higher centers. We at district level, we are giving some 2 to 3 millimeters of local anesthetic injection and doing surgery. But in higher center, just topical drops, they are doing surgery within half an hour or 1 hour. He will be back from the OPD with the complete vision if his eye conditions, eye environments are normal. That patient's compliance counts a lot. If he's not diabetic, if he's not hypertensive, if his health condition is very, very normal, his eye will respond so nicely. He will have normal vision. Within 15 days, he can go back to his work, to any office, bank, any work normally. Up to 6 weeks, he has to have post-operative care and he has to put some ocular eye drops to maintenance of the inflammation to prevent any complications like that. So phacoemulsification, laser surgeries, and injectable IOLs, foldable IOLs are the miracles of scientific field. As a con, so many will have the complications. Any surgery at the cost, any surgery will have any complications only. Compared to the benefits of 98% benefits, only 2% of complications are totally negligible. So with bold decision, they have to go for surgery. In Indian population, 60% of the blind people are blindness. Blind people, if 100 are there, 60% of them are because of cataract. Because of cataract is, the symptoms will be blurring of vision and night driving will be affected, and polyopia, seeing the multiple images. If he wants to see a particular object, he will get the multiple images. And that disturbance makes him not to go to the work. He is socio-economical. And this first point, this is slow disease, not occurring within a 1 day, age-related, I told you, slowly occurring. So the patient is hindered to go to his work. His socio-economic conditions will be affected. That socially he is becoming poor. That poverty makes him not to go to the doctors. This is a vicious cycle. So 60% of the people are blind people are because of cataract. So simple surgery to give the good correction because of this, to correct this problem only. Government of India, 1976, they implemented national program for prevention of blindness. So many programs have been implemented. All district hospital, taluk hospitals, big centers are conducting free eye camps and giving the spectacles to the patients who are having the refractive error and collecting the patients to the higher center, referring them and doing the surgeries at the higher centers, putting the IOL, keeping them in the hospital, giving the food and sending them back with the medicines as well as the post-operative glasses, refractive presbyopic glasses also. The national program, under this national program of controlling of blindness, free eye camps to schools they are doing. In the school-going children will be having the refractive error. So many children will be neglected not to go to the hospital. Totally they are neglected because they think that the boy is interested to see the cinema or TV, so he is sitting very near. In that way, the refractive error will be neglected. And so many will be having night blindness. And squint is a commonest problem during childhood. They think it is once again neglected because they think it is a good sign. Squint is a good sign to have it. Not like that. If it is really corrected surgically, you can just keep the muzzle anteriorly or posteriorly 2 to 3 millimeter so that the alignment of the eye will take place. The parallel nature of the eyeballs will be maintained and look cosmetically it will be nice. If there is a refractive error, it should be corrected. Refractive error means spectacular point, we want to say, points, minus or plus points like that. We have to correct the refractive error in the young age group only. It is mandatory because eyes fixation at the macula or retina will take place at the age of 6 to 12 years or 14 years or less than 12 years. During that period, the refractive error is not considered, not corrected properly with contact lenses or with glasses or any surgical procedures, the vision will be hampered. The patient will have less vision only throughout his life. It's a very dangerous thing. Whatever the correction, whatever the surgery you do after 15 years, he won't get back his vision because eye has become lazy eye. Laziness developed in that eye. Eye will become submerged. So correction of vision is very important, and squint correction is important in the younger age group. In younger age, they will have night blindness, so many retinal problems. Congenital glaucoma. Glaucoma is also, it can be seen in the younger age group. Congenital glaucoma, refractive errors, and retinal tumors sometimes should not be neglected in the younger age groups. So free eye camps, there's the importance of free eye camps, recognition of the disease, prevention, once again, and stress on the prevention is far, far better than a cure. Instead of going for a heavy treatment, recognize the problem in its toddler way, in the earliest way, and treat them effectively, and the effect will be very nice. So cataract, I told so many points in cataract, and cataract cannot be emergency, but it will be cataract will be emergency. It produces the lens-induced glaucoma. The cataract will bulge open at the center, it increases the intraocular pressure and produces the glaucoma. It is a suddenly, patient will start vomiting, headache, he will be hospitalized for any gastroenteritis. So many times he will be admitted for gastroenteritis. If we examine him thoroughly, then we can recognize his lens-induced glaucoma. He has to put for the emergency treatment, emergency surgery. So many times he may not get back his vision. Even we do surgery with so much of effort, but because of glaucoma, if it is maintained for more than 24 hours, 36 hours, what is the use of doing surgery also? But we have to do to relieve from the pain and all. This is cataract, national, and so many policies are available. Government health policies, mediclaims are there. They are providing free eye surgeries. 20,000 money they can claim. They can claim for any cataract surgery. And Pradhana Mantri, Jana Yojana, those aspects are covering the cataract surgery free of cost. They are doing surgery, and the work of Lions Club. The work of Lions Club and Rotary Club, Shankar Eye Hospital, they tremendously, though they are getting the benefits from WHO and all, or foreign countries, but their work is very, very, very qualitative. I want this magnified. I don't want this.
Don't want this.
I don't want this. I want only this. Anita, can you hear me? Anita?
Yeah, we can hear you.
Yes, we can hear you.
Okay. Some mistake, something wrong was there. Okay. So, Pradhana Mantri Jana Yojana and so many mediclaims. You ITBT people are having so many mediclaims. The Shankara people, Vasan people, so many metropolitan hospitals are there. They are covering good service of these surgeries. Any eye surgeries in the aspect. So Yashaswini cards are below PPL cards are there. Just facilities are there. Even imagine my colleagues are keeping phacoemulsifying machine in the government hospital. Please. Government hospital, they are doing so. One of my colleagues is keeping in Megan Hospital. She has kept 7 to 8 lakhs. She has invested on the phacoemulsifier machine, and she is doing a charitable work at government. She is a government employee. See, the government is doing its best service, eye camps and all, but people should have the faith in such things. People should have faith on such services, and they can get done free services, mediclaims, the reimbursement of money is there, but should not be, any treatment should not be delayed only for the aspect of money. Only for the aspect of money, because we may end up in complications. Now, we comes to another one is glaucoma. It is a glaucoma, you might have heard. It is a very, it is a silent killer. It is a thief of the eye. It kills the eye. It thieves. It is a theft that is going on in our body, but we cannot come to know about the vision. We come across so many patients are coming to hospital, totally lost one vision in one eye, only hand movements. Other eye, they might have come for blurring of vision because it won't produce symptoms much. Only few, so the knowledge is once again very important. The patient may have headache, blurring, slight blurring of vision, reading difficulties. They cannot mark straight lines. They cannot follow the straight lines or exact lines. Sharpness and color vision will be little bit affected. Night driving will be affected. These are the mild things. They are not particular towards the glaucoma. So the patient may neglect the glaucoma. And this runs in family. Heredity is the important thing. So anybody in the family is diagnosed as glaucoma. Or you heard the news that anybody in the family is advised to put eye drops lifelong. Okay, lifelong. Then be aware of such things. It is an alarming information in the family. The family members should go for the eye checkup. That's what is the duty of an ophthalmologist. After 45 to 50 years, they will record his intraocular pressure, IOP, compulsorily, just like vision. As the physician will examine BP, blood pressure, just like that, IOP, intraocular pressure, there's a mandatory points to be recorded in a person after 45 to 50. And family history of patients. We have to call the patient attendance for the checkup. Within fraction of a second, we can record his intraocular pressure. And glaucoma is a broad entity. It includes three things. One is raised intraocular pressure, which is 14 to 21 millimeters of mercury. More than 21 will be glaucoma. Second point is the optic nerve cupping. Optic nerve is, retina. It's a light sensitive area. It is behind the eye that takes the impulses, passes as a optic nerve, leaves the orbit, passes into the brain. During its course, there is a decussation, means crossing over, decussation. Then it enters into the posterior aspect of our skull. See, you might have heard so many times the patients or people will be having a big hit at the back. Without any damage to the eyeball, they will lose their vision. Any bleeding in the posterior aspect, there is the occipital area, or trauma, or accidents and bleeding, the patient may lose his vision bilaterally or unilaterally, or hemianopias. Half of the vision will be disturbed. That is a miraculous thing. See what we are seeing. Eye acts as a camera. We are seeing through two eyes a single object. That two images are passed through the two optic nerve into the brain. Behind the brain, we are appreciating the thing as a one in a stereoptic, means three-dimensional vision. X, Y, Z, three-dimensional vision, depth-wise, depth perception is so nice, color vision, everything. That is the beauty of optic nerve and God's gift, miracles. In glaucoma, what happens? This optic nerve cupping will be there and restriction of the field. We can see 180 degree at our temporal area, at 70 degree or 60 degree at the nasal area, upper part and lower part at about 60 to 80 degree. But in temporal area, the visual field will be obstructed. There, the patient will start seeing the scotomas, dark spots, or halos. Halos means light color, the halos around the light, round things around the light. And multiple vision sometimes, blurred vision, gradually. So it's a composite of optic nerve, optic atrophy, optic cupping, and peripheral field obstruction or narrowing, then visual defect with intraocular pressure high. Three aspects there in the glaucoma. So it's not dangerous. Do you think it is so simple? No, because it is challenging to the doctor, because medically and surgically we cannot correct it so nicely, even to 100%. That's what awareness of such things and knowledge regarding such things and early detection is best policy. Medical line of treatment, surgical line of treatment are there. Medically, iotim, xalaton, mesopt eye drops, so many darzolamide, so many eye drops we are using. And if the control of the intraocular pressure is less than 21, well and good. there is a sigh of satisfaction, because once the vision is lost by retina, whatever may be the cause, we cannot get back the vision back. We can never. Once damage of the optic nerve, damage of the retinal vision, no, we cannot get back. If the patient lost his vision because of glaucoma, because of optic atrophy, something like that, or diabetic retinopathy, something, if the vision is lost because of retina, 50%, okay, 40%, okay, 30%, we never gets back that 30% or 40% vision. Why you are worried then? Then we are worried about the remaining part of the vision. It is our duty, and it is a really needed thing. We have to have whatever the vision left. Once the patient experience, he has lost it, and he will be crying to remain his vision, what is left there. That is the aim of the science, aim of the medicines. The glaucoma treatment medicines are very, very costly. If I put one drop and automatically it closes its mouth, not to waste the other drop, because 3,000, 4,000 per month, that water costs. So it is really once again socioeconomic problem. Their lifelong they have to put it. They can't stop it anyway. If there is no control with the medical line of treatment, then we have to go for surgical line of management, surgical trabeculectomy, laser trabeculoplasty. So many surgeries are there. Even though whatever the effort, once again the patient's compliance differs. Some people will have good result, some people may not have good result. So earliest detection, earliest treatment, awareness of the eye defect, eye problems is very, very important. Now we comes to Anita or some. Is it okay, Anita?
Yeah.
You are getting no?
Yes.
No problem?
Yeah.
Let me continue.
Yes.
Okay. Now we pass on to diabetic retinopathy. Earlier, when I was using it, 25 years back, when I was a student, they used to teach diabetes only in rich people and Western population. No, now India has become the diabetic capital. We are normally moderately built and moderately nourished people. Our body stature and all are so built that we have to work hard, we have to eat. If we comfortably sit for more than 6 hours, 5 hours, our truncal obesity will increase. So falsely we are believing or following the Western population eating habits and sedentary life. The life has become so much advanced. Our profession has become like that, engineering and all. They have to work they sit for 6 to 8 hours. Physical mobility has been reduced, and even ladies are also putting much effort at the household activities because of machineries and all. And everybody, all our activities are hampered because of modern lifestyle and our food habits. No question about it. Food habits changed like anything. Pizza, burger, all are processed food. And they are preserved for 6 months, 3 months, 4 months, 2 months. And the animal fat is used to maintain it. Because of our bad food habit, because of our sedentary work, we people are increasing the weight in the trunk area. Truncal obesity is a bad sign, and they are the prerequisite for diabetes and obesity, hypertension, and thyroid problems and all. This is not the superficial fat. This is the omental fat. It's the visceral fat, not the superficial fat. We cannot remove by liposuction. You might have seen for the models and are getting it done, liposuction, putting the tube and removing the fat and all. It is the omental fat that is covering over the intestine, that omental intestinal fat that we cannot handle. That is covered because of only our food and sedentary life. That is once again, I'm telling you, this obesity and all increasing our diabetic patients. Diabetes is noticed. Diabetes might be diabetes noticed in young individuals. It is insulin, NIDDM, insulin dependent diabetes, and non-insulin dependent diabetes. Young individuals also getting the obesity and diabetes. MODI, that is maturity onset diabetes in young individuals. Though they are not insulin dependent, but they are diabetics as like adults. See, so bad, miserable part of society. And gestational diabetes is diabetes seen in the pregnant ladies. That is because of pregnancy. It will be relieved once you delivered. And if her diet and all maintained properly, she may not continue her diabetes. Okay. See, why I am giving importance for diabetes? A lifestyle disease and known for its complications. It is a microangiopathy. Diabetes affects the small, minute of the minute blood vessels of the body. So, retinopathy, affecting the retina, cardiopathy, cardiac problems, heart ailments and heart attack and all, nephropathy, kidney problems, and dermopathy, skin problems, and neuropathy, small nerves are affected, peripheral nerves are affected, and neuropathy. These are the pathies. They are the 5 pathies. Usually we teach the students like this. These are the most important complications of diabetes. Just we can't neglect diabetes. Don't be afraid of diabetes. Just I want to, it is a lifestyle disease, I told you. Don't be afraid of any disease. Try to understand, have the good knowledge regarding the disease. Try to avoid it. See, 50% of the diseases are avoidable because of our lifestyle, eating habits and all. ಊಟ ಬಲ್ಲವನಿಗೆ ರೋಗ ಇಲ್ಲ. So we heard such that when we used to hear ಊಟ ಬಲ್ಲವನಿಗೆ ರೋಗ ಇಲ್ಲ. The lifestyle, eating habit, all these are really helpful to our health. So many 50% of the disease we can't avoid. Its destiny is different. 50% we can avoid so that our quality of life will be nice. We can enjoy the life step by step. If we are not allowed to walk itself, then what is the use of this body? If we are, because of osteoarthritis, so many people are stick on to the home. What is the use of this property enjoyment? They can't go out. If the vision is reduced 50%, they cannot see, go to the movie theater, they cannot enjoy it. So, and if the obesity is so, they are obese, so they cannot enjoy the Mysore Pak sweet. So what is the, that's what, enjoy the life with, and main thing, we cannot get anything so easily. That is the thing. If you want to get good marks, we have to work hard. If you want to achieve some goals, we have to work hard. If you want to earn money, you have to work hard. Just like that, life also, this health also won't come easily. We have to work hard on it. Some knowledge, some exercise, some yoga, exercise of any way. Walking, cycling, cardio, or yoga, walking, something like that. Any type of exercise for 1.5 hours, at least 1 to 1 hour exercise or half an hour yoga, meditation and all really counts a lot, helps you in the life. So the diabetes is the worst part of the common people, normal people. What it it may not produce any symptoms sometimes. So last 15 days back, a lady had come to us with loss of appetite in our OPD. Just we treated her with some medicines and all. Once again, she came and her, if we say had been for investigation, her creatinine level was so high. And she diagnosed as diabetic and hypertensive. She was neglecting her body, just 45 years. Now she is going for renal failure and she is under dialysis alternate days. She is just 45 lady. Her daughter is studying engineering. See, because of negligence, she was busy in her own work and all, and she happened to be diagnosed as diabetic and hypertensive renal failure. The patients came to us so many times with just blurring of vision, lost their vision because of diabetes. Diabetes may affect the eyes from beginning. Lid infection, hardiolum and all, cataract once again, vitreous hemorrhage. Morning he was okay, the patient was okay, he's about to go to Saudi and all. The next day his flight was there. He was a young individual of 40, had come to me. Suddenly he gave the history that something is moving in his eye. And he some veil-like appearance. Veil is coming in front of his one eye. At thorough examination, he came to know that he was diabetic and he was on insulin also. And there was vitreous hemorrhage. Suddenly vitreous hemorrhage. And other complication noticed is small hemorrhages over the retina. Dot hemorrhages, blot hemorrhages, flame-shaped hemorrhages, exudates. What nothing, retinal detachment and loss of vision. These are the complications of retinopathy and diabetes. So if the patient has to be diagnosed early, and one thing, the patients are very in a hurry, so they don't have any time to go to OPDs, to the ophthalmologist. They don't want to waste their one day, because we ask them to sit for half an hour, 1 hour, 2 hours in the OPD by putting dilating drops. After post dilating drop, they will have 4 hours blurring of vision. They cannot drive also. That is one thing. So many will hesitate. That is very bad part. Health is wealth. Once again, I'm stressing you. Earliest detection of the diabetic points. If you dilate the pupil, see the retinal problems in early, we can ask them for diabetic evaluation, hypertension evaluation, thyroid evaluation, and rheumatoid arthritis, any connective tissue disorders in the body. So many investigation. We can halt the vision to be, the retina to be damaged. Then we can ask him fundus fluorescence, FFA, fundus fluorescent angiography. Dye has to be fluorescent angio dye has to be put in the cubital area. Suddenly it enters into the retina, and we take the frequent photographs of the retina so that leakage point can be detected, give the laser treatment in 3 to 4 sittings. That is PRP, pan-retinal photocoagulation, laser, or focal photocoagulation. A maculopathy can be handled so nicely, so that further damages, what I want to stress you, once damage only. So try to stop the further damage of the retinal vision to that patient. He will be protected. And further complications like vitrectomy, put the silicone gel in the vitreous, vitrectomy has to be done, air has to be put repeatedly, the vision, whatever may be the surgery, vision will be hampered in that such patients. Retinal detachment surgery they are doing, but result will be very, very less that such complicated cases. To prevent such things, we have to have the awareness, go to the ophthalmologist, regular blood checkup, regular vision, at least once in 6 months or once in 1 year. Just go to the ophthalmologist, check your retinopathy studies and all. And you have to keep your legs just like your face, because we have neuropathy, wet gangrene is very common. They have to sacrifice their food, sacrifice their leg, amputation and all. See, with the insulin injection and amputation of the leg. See, it's miserable to the patient. And renal problems, nephropathy, dialysis, or kidney transplantation, they have to go. And cardiac problem, you know that. So, earliest, once again, I'm giving stress to the retinopathy and retinopathy, how to handle it, what are the complications and all. And important thing is computer eye syndrome. The modern generation is totally, everybody are addicted to the computers, are addicted to our laptops or electronic gadgets. 1 in 5 students throughout the world are with smartphone or laptop because of their study. They say because of studies. And engineers, software engineers, they should work under the laptop or computer only. And we people, for everybody, entertainment also through the laptop or where smartphone. This is that's what the term has come. That is computer eye syndrome, visual fatigue. The patient will complain more than 6 hours they are using the computer, more than 7 hours they are using the electronic gadgets. What happens to eyes? Eyes are maintained to be free and relaxed in the normal environment. They are adjusted to just read and relax, see the distant objects, not this type of electronic gadgets and all. So try to avoid such things as much as possible. The complaints are so severe, beginning from headache, eye strain, sleeplessness, watering of eyes, neck pain, back pain, hand pain. Some people will have nausea, vomiting like. Some will have even infertility because of spermatogenesis will be affected. They are keeping the hot laptops, very hot, I think, and that will affect the spermatogenesis, younger individuals. See, and we are forced to go for the MRI scanning in so many software engineers who have come to us because the complications, we want to rule out the neurological problems in such cases. See, try to avoid as much as possible these electronic gadgets. Outdoor games, outdoor, chit chat with friends instead of chatting in the WhatsApp or something like that. Speak out, speak through the phone, speak outside, go out, move out. That will, ambulation is so healthy for your maintenance of health. How to avoid this computer eye syndrome? Computer eye syndrome, the computer screen should be in a bright light so that the color contrast should not be more. Don't see in the dark light, and should be for handheld distance, not beyond that. And the hands red should be 90 degree. Our foot red should be 90 degree, flat like foot like this. And back, there should be a back rest, and the head should not be too much flexed or too much extended. Our eyes, our pupil are so much directed that they should not be over opening of the eyelids or narrowing of the eyelids, so that comfortably we can read, see the screen things. Font size should be tolerable size, font size of the letters. And 20-20-20 rule is, that is 20 minutes, each 20 minutes, you take a break of 20 seconds and see a distant object of 20 feet. So as the accommodated eyes, during our near work, our eyes are closely coming and accommodated, adapted. Now relax, seeing the distant object, keep the two eyeballs straight. So otherwise you close your eyes for 20 seconds, relax, or move out for 2 seconds. If time permits, move out, do some work and come back and sit. This is a computer eye syndrome. And other thing is self-medication. Self-medication in our society, in our general population is very, 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 very dangerous. Especially for eyes is very dangerous. I don't know about your medical, you will be taking antibiotic, crocin, those things. That's okay to some extent. But eye, really strictly no. If at all something foreign body fall in your eye, if you want to wash your eye, just put the tap water or aquaguard water in the bowl and just blink your eyes and clean it before going to a hospital. If you are highly knowledgeous, English knowing, all are English knowing people, you can put antibiotic eye drop, that's all. Because so funny things have occurred. A SSLC student came 2 years back. He came to me with, he's not able to see the letters only before going to exam. In the early morning, he came to my house because I used to stay at my upstairs house. They came to me and knocked the door. He's not able to see the letters. And just I asked the history, what medicine he had put and all. Without examining only, I took the history. Just he told he was using some ointment which was prescribed for his mother, granny. That was 100% atropine eye ointment, which was prescribed for Ajji, Nani, for post-operative treatment. Atropine is a dilating medical eye ointment. It dilates the pupil for 7 to 10 days. Accommodation failure. They cannot see near things. They cannot write anything. He could not attend one exam of 10th examination. These things. And we are used to, who knows that medicine, others medicine will be steroid. Who knows it is a glaucoma treatment. So self-medication or medication with others, medical drops of others who are using it, don't use such medicines, because if the cornea damage in new people, if there is a trauma in a patient, they are using steroid. It is a very, very, very bad treatment for him. Early morning, next day morning, they will come with a corneal rupture, corneal ulcer, or perforated corneal ulcer. Worst case, worst of the worst corneal in ophthalmology sees the perforation of the corneal ulcer. So don't use others' medicines. And medicines and few are over knowledgeous. They think I know so many things. They in village now also they are using butter into the eye. They use turmeric powder and they use the water which is soaked in the coriander seeds. They are using during the madrasa and all the contagious disease. They used to have the coriander soaked water and all. So really unscientific. And 6-7 years back, the lady was of 35 years. She came to me and she was admitted for eye problem only. I was treating her. There was no good improvement. Her corneal ulcer. Corneal ulcer. She gave the history of trauma, that's all. But I elicited through the attender. She was staying in the temple. She was putting some medicine or drops like that, some local drop from the quacks and all. And turmeric powder. She was in the temple only for 1 month, just for her corneal ailments. She had some trauma. She might have gone to hospital and they would given her treatment. It would have been solved so nicely. She herself made it. She lost her total eye. Then she underwent keratoplasty. Keratoplasty means transplantation of the cornea from other. Now she is on treatment for the past 5 years for her corneal pathology. So it is ignorance. Ignorance should not be there, because eyes are so delicate and the God's gift, and nobody can handle so easily. Take it easy policy. No, any drops, any medicine, anything cannot be put in the eye, though they are outside just like skin, but we have to protect them. We have to protect them. Self-medication, atropine, steroid, these are very, very bad. And steroid drops, I told you, for allergy, especially for allergy, they will go to medical shop, they will take some medicine and go on putting, because of itching, they want to have the relief, sudden relief and emergency head treatment. They will start using the steroid drops, that they may end up with the glaucoma or after cataract kind of. Self-medication in the sense, other things comes, the quackery treatment. It is, I should mention this point, because people are attracted towards the quackery in village side especially, and they unqualified person. The unqualified people will give what they can give, Ramabana. We call it in medical field Ramabana. That is steroid tablets. They might be giving small tablets. Who knows what it includes? Might not. So don't go for any unnamed medicines. See, the lady has come to my husband. She was about 50 years. She has put on weight 20 kgs, 95 kgs. And she told, I'm overeating, that thyroid ophthalmopathy, thyroid was also not there, thyroid ailments was not there. And she was on borderline hypertensive. She was about borderline diabetic also. And she gave the history. She is not taking anything. And just immediately within 3 months, she has put on weight. Only 3 months. How can it be? 3 months, they can reduce the weight by diabetes mellitus. But you can't put on that much of it within 3 months unless there is medicine. So we asked the attenders, we dig like anything, so many times cross-questioning and all. Then the history came, because of her osteoarthritis, she was on some tablet, small tablets. She totally negligent. She was forgetting. She is taking that tablet, small tablet I am taking, small tablet. Then we considered it was a steroid. Because of steroid. They are very, very bad to health, though they are very emergency handling medicine. But for a long-standing treatment, if they are prescribed from the unqualified person, dangerous to health. See, she had obesity. Obesity produces the diabetes mellitus, hypertension, thyroid problems. In turn, produces the diabetic retinopathy, cardiomyopathy, so many complications. Instead of becoming normal, we are becoming worse, to relieve just the pain. To relieve the pain, osteoarthritic pain of the joint, the complications are increasing. This is so the steroids and quackery treatment are not good. Hello, Anita? Anita?
Yeah, Bharti.
Yeah. You are audible, and I'm sorry, I was on mute. So I couldn't
okay. Now, the next point is important point. Everybody asked that LASIK surgery. LASIK is the trend of the new LASIK new generation. The people are interested to what is LASIK. LASIK is a 99% success rate surgery of modern technology. We can remove the glasses, we can remove the contact lenses, the patient will be 100% normal after LASIK. It is laser assisted keratomileusis in situ. In situ keratomileusis, laser assisted. Laser beams are going to be put over the cornea. Two techniques, that is taking two flaps and making a pouch and putting the laser. See, two flaps, for the underlying flap, we are putting the laser beams, so flattening the cornea. We can correct up to -8 or -10 myopia. See, imagine, -10 glasses individual cannot see a 5 meter distance also. Such person, 5 meter, not 5 meter, even 3 meter, that's all. Such person is getting the vision 100% after LASIK without any glass or without any contact lenses. Is it not a miracle? And hypermetropia also we can correct up to +5. See, these are the very, very beautiful advantages of the science, advantages of gifts of the science to younger generation. So many are hesitant to wear the contact lenses, so many hesitant to wear the thick soda glasses. They really, but up to 10. The side effects or cons are you cannot advise the patient beyond 15, -15 or +10 and all. Then they have to go for the ICL, intraocular contact lenses. The contact lens has to be placed within the eye by a qualified surgeon, best surgeon. There, the problem will be solved. And the patient LASIK is very costly. Earlier, it was about 2 lakhs together. Nowadays, the price has been reduced. It is about 50%. Some of the insurance policies are towards the LASIK. The patient can claim back against the LASIK price and all. Even free camps are also available, but some hospitals are not allowing LASIK because they think it is a cosmetic surgery. Under the reimbursement, it is not coming. Few hospitals still doing the best free service for LASIK. Anybody can go. When keratoconus, bulging of cornea, if the corneal thickness is more than 495 microns, then less than, then we cannot go advise the LASIK therapy. LASIK is a beautiful and simple. Within this talk only, the patient will be out of the OPD 20 minutes. That even the procedure for the machinery adjustment, machine will do that. Machinery adjustment within 20 minutes, you will be away from. The complication is just dryness. Dryness is just 1% complication. The dryness can be overcome by means of drops and all for 2 to 3 months. Now, keratoplasty. Now, LASIK is over. Keratoplasty is the thing to be discussed. Nowadays of organ donation or body donation after death. You might have heard so many people are donating their body after their death for students to study in medical colleges. This is the thought today. But eye donation after the death of an individual, donation of cornea or donation of eye is really gift to the society. We can see the world even after death. Two people can see. When Puneet Rajkumar's cornea were utilized for 4 members, partial thickness of the cornea were used. When Rajkumar donated his 2 eyes, after his death, 2 members took the grafting and see, 24/7, these people are working in eye banks. Just like blood bank, eye banks, government is also providing aids to the private sector like Lions, Shankara and Rotary. Those people have the great, beautiful, hardworking, dedicated team. That team is going to they receive the phone call and immediately they go to the house of a dead people and they collect the eyeball and store the eyeball in the preservatives. Even 24 hours, 48 hours, even for 6 months, they can preserve the eyes. Imagine, so nice preservatives are available. And the patient's eyes cannot be, face cannot be looked ugly. They will manipulate it. They'll keep the cotton and all. They make the eyes face to be appears to be normal. So anybody can donate their eyeballs after their death, except for corneal pathology people who had leukoma, corneal opacities like that, any AIDS and all, viral diseases, herpes zoster, herpes infection of the cornea, those people, whatever it may be, the doctors are there to study the cornea thoroughly, microscopically before transplanting to the donor. The donor will be called it should be collected within 4 hours. And the donor will be called immediately. His name will be in the list. And we people are planning surgery within 6 to 8 hours. Just cutting the cornea of the host and keeping the donor's cornea at the center, stitching it surroundingly, and he has to be on immune compromised medicine or steroid like that for 6 months or 1 year. They should go for repeated follow-up. That is the thing. But to get the vision, that follow-up treatment and repeatedly visit the hospital is negligible to that patient. He was not seeing anything. Only corneal problem can be solved with keratoplasty, KP or keratoplasty. And retinal problems, I want to refractive errors. Refractive errors, that's what I want to give the importance to the refractive error solution. So many contact lenses are available, glasses are available, LASIK laser is available in the medical field. And if it is advised by a doctor, don't hesitate. Patching is done, has to be done. You have to close one eye and to stimulate the other in the children. 1 year baby, we are giving the contact specs. 1 year baby, the mother has to tie it behind it. Otherwise, the stimulation of the retina may not occur. So don't neglect, especially in children, refractive errors. And hypertension. Hypertension, you know, diabetes and hypertension, they go side by side. Hypertension, once again, obesity. Hypertension, that is malignant hypertension. More of high blood pressure to that age group. 120/80 is a normal one to the younger individuals or middle age group. If it is more than 120 or 130 systolic, diastolic more than 90 and all, hypertension. Along with nephropathy, kidney damage. Kidney damage is very common. And along with that, there is the optic atrophy or papillary edema. Optic nerve edema may occur, and he will lose his vision. That is, intracranial pressure will be more. We have to treat such patients energetically, emergency, and hypertension should be treated very, very nicely. Compared to diabetes, high blood sugar, hypertension is worst. One of my close relatives, she was about 55, not shown to any doctor. She was normally doing all activities. One early morning, she was sitting in the chair, fell down suddenly. Without lost her conscious, and she could not get up. They took her as an emergency to the hospital, admitted. She was diagnosed hypertension, leading stroke. She was paralyzed totally, stick on to bed since 2 years. She is just eating, that's all. No bladder control, no bowel control, not moving. One of my close relatives. That's what, regular checkup, go to a qualified person. There, they will record the BP. If there is high BP, they will mention you. What he is going to lose. Doctor is not losing anything. Just he will tell you, little bit of high blood pressure, go for medicine, also do yoga or exercise like salt restriction, that's all. Reduce the weight and all. Suddenly knowing the bad things is very bad. Meeting the complication, met with an emergency complication, really bad. So regular, that's what the Mediclaim people or health insurance policy people are doing, regular health checkup. After 35, we have to undergo regular health checkup. Blood pressure, blood sugar level, cholesterol level, cholesterol, HDL, LDL, VLDL are very, very important. Lipid profile, we call it as. High, that's friendly, heart-friendly cholesterol is also there. So we should only can't take a total cholesterol, which is why bad cholesterol, good cholesterol. Bad cholesterol also there, good cholesterol also there. So thorough thyroid, so many are putting their weight like anything. They think because postnatal, after delivery, lady is putting her weight. But need not be the overeating. Might be she is having any thyroid ailments. Just a treatment of thyroid norm in the morning, she will have normal thyroid level. She can reduce her body weight. Complications can be halted with just investigations. That's what prevention in the systematic way. Have a regular health checkup. Thyroid, hypertension, diabetes, and cholesterol level. Your weight checkup, your vision checkup. Dentures, so many complications with the dentures and regular weight checkup. So maintain the health by exercise, walking for 1 hour or any vigorous exercise in a gym like that, 1 hour, half an hour yoga. Yoga to maintain our health means meditation. So we always stress this point to our aged individuals who are having BP and because to calm down your stress, tension and be tension free with yoga, meditation and these are lifestyle diseases because the hypertension, BP, these are very, very common only these 20 years. Earlier, people were not suffering because they used to work in the farms. Whole day used to work in the farms. Whole day they were physical activities were so high. Nowadays, young, starting from LKG, UKG, the children are getting tension. They can't do so much of heavy homework and all. To come to the teenage group, they have their own competitive field, NEET examination, CET, JEE, that thing, this thing. They are much worried. Once they settle, they settling problem, economic, they have to earn that much. Because earlier, people used to have the property after retirement, after 60. Now, they want to have house, they want to have car, that thing, this thing, only 20-25 years only. So the age-related diseases are appearing in the younger individuals. So be tension-free, be tension-free. One thing is glaucoma. Yes. Anita, hello, Anita. Anita?
Yeah.
Time permits, let me continue, or you want to put for question answering? That will be better.
I think we'll have the QA session for 10 minutes because
Okay.
the session was totally 1 hour. So.
No, if time permit, definitely I am big
No,
because ophthalmology.
Probably we
so,
can have an additional session later. Because
okay, time, no, that's what I am asking you repeatedly. I can continue like this only if there is permission of time.
Yeah, let's open for questions. So if anybody has questions.
Yeah, the first question I will ask. You said looking at the laptop or sitting in front of laptop for more than 6 hours is not good for eyes, right? Because you are staring at the laptop for continuous 6 hours, especially in the software engineers like us. We may have to work for more than 12 to 16 hours per day. Many times it happens because you have to complete some deadline and all that, so you'll be sitting in front of laptop. So in such cases, what do you suggest? Because I think there are lot more software engineers who have joined across. I think it is lesser burden for the people who are in other countries, but especially Indians in India, I think it is more. So what do you suggest? What we should do?
That is your problem. Actually, you engineers, it's your basic problem you are asking me. But as a doctor, I should explain the problem, side effects of the overuse of the computers. One thing we can say, put the screen guards to protect the rays which emit. Who knows what rays they are emitting? UV and absorbent protective screens are also available to the screen of the computer. That way it will protect. And you have to wear the glasses or prescribed glasses while using the computer. And don't avoid contact lenses because they may irritate your eyes. You will end up with complications if you are contact lens wearers. And every 20 minutes, definitely you can take a break. You can put an idea to your heads and all. And at least every 2 hours, you can have half an hour break. You can request to your company. It is health hazardous because your back pain will start, your hands will start aching, your gastritis will be more and all, indigestion problem. Those problems you have to explain to the company. At least after 2 hours, you take 20 minutes gap. Get out from the room, be outside, see the greeneries, distant object, do at least some physical activities, be hydrated, and come back to your position. These things and bad habits. Okay, this you can do, Anita.
Good evening, ma'am. So I have 2 questions basically. My name is Lakshmesh. I'm joining from Saudi Arabia.
Saudi, okay, sir.
Yeah.
Namaste.
So I have 2 questions. First question is the eye discharge in infants. So are these very common or is it alarming that we need to be worried about?
Yes, it's a very good question. So eye discharge in the children or young individuals or newborn, it should be considered as it is a single eye or both eyes. If it is both eye discharge, first point is infection. During the childbirth, during the passage through the childbirth only, they will have infection because of the mother getting the infection in the lower spectral area, and the baby will be having the infection. That is common.
Yeah.
For that common problem, they will treat the infection. It will subside within 1 week. If it won't subside, if I am telling about bilateral only, if it is not subsiding, it is alarming. It will subside after 10 days, once again it will reappear. Or bilateral or unilateral, one eye. And that discharge will be continuing. If we apply some medicine, it will disappear. Once again reappears.
Correct.
This saga, this story will continue up to 1 year sometimes, 6 months sometimes. That time, and some think that taking a massage to the baby during bath and all, it will come down. That is also what's good, but sometimes it may not stop. The discharge may not stop. It is alarming sign. What happens? The eyelid, the watering or water of the eye is designed to pass into the nose through a one canal here. Lacrimal sac is there and nasolacrimal duct is there. Water, tears of the eye pass through the sac, nasolacrimal duct, enter into the general circulation. That is the normal passage. But in some babies, at the intranatal growth during the pregnancy only, the passage is not canalized. It is not the pipe, water pipe. It is just electric wire. Yeah. So that is alarming sign. Bring the patient to the doctor. They will give hydrostatic pressure over the sac area so that sometimes the passage will be occurring and the baby will become normal. If not, we have to do probing. We are making the passage in that canal under the local anesthesia or general anesthesia, or making the baby to sleep. If it is repeatedly, we have to do. If not so, the baby has to end up after 1 year. That's a DCR surgery, dacryocysto-rhinostomy surgery by laser assisted.
Okay.
Okay, is it clear?
Yeah. Okay. I have another question. Second question.
Yes, sir.
Basically, generally in people, if someone in adults, basically, so if they have any eye infection, so there is a very old saying that if there is any breastfeeding mother, right? So if they put 2 drops of
breastfeed, yes, common.
So is it approved one, or is it only a?
No. That's what I did not mention. Self-medication and they think they're over cautious about they know everything. They say like that, I know everything, how home remedies and all. No. Just I told you, avoid the turmeric powder and all. Don't butter and all. Breast milk is known fact. They think it is sterile. It's one way it's good. A sterile drop, they are putting it to the eye. It is not at all good. Who knows that itself is contaminated before putting, because they will collect the breast milk in a bottle or a container, and that bottle itself is, or bowel itself is contaminated. And after that, they are putting it to the baby's eye or somebody's eye, and we are transferring the infection to that normal individual or infected individual. It is not a good thing. Basically, it is sterile, but sterility cannot be maintained to put into the other eye. And sometimes what happens, fungal infection may occur. Milk will become a prerequisite or a foundation for the fungal infection. Not good, not advisable.
Okay. So I have one more question. I'm sorry.
Yeah, no problem. Time permits, I am ready to speak.
Yes. Because again, so if we frequently apply oil like coconut oil or any oil to the head, so the people will tell that will keep the eyes in a good health. Is that true, or
no? It is a myth. It is a myth. So many are not using the coconut oil, but they have the normal castor oil, whatever may be. And it is not directly related. It is once again a functional. Organic and functional, you know the difference. Organic means it is directly related to body. Functional means satisfactory, psychological satisfaction. If mother keeps head, we'll feel very happy and comfortable. Just like that. If we put coconut oil over our head, it soothes the skin, mind, everything. And the point is, once again, who is doing that massaging and that is important. Mother does know, it's really, baby will be very satisfied like that. It is not directly related.
It's more of a psychological.
More of psychological. And putting dye is organic. If we put dye to the hair, coloring agent, that definitely it will produce the allergy to dye. So many will have the allergic reaction into dye. Mild to moderate, even severe. We ask them to stop the dye. But if few are mild and they will neglect it. But few are allowed not to put any dye to the hair. Coloring agents cannot be put. So in so many people.
Okay. Thank you, ma'am. Thank you.
Okay, thank you.
Any more questions?
Bharti ji, namaste.
Namaste.
Seattle.
Praveen?
I have one question. Yeah,
Who is
Praveen.
Praveen from
Seattle, USA.
USA. Okay, sir. How are you? How are you?
Yeah, I'm good.
What
Yeah,
is
I'm
the
good.
time now there? What is the time now?
It's 7:54 in the morning.
Since how long you are there, sir?
I joined at 6:30. Yeah.
No.
From the
Since how
beginning.
long you are there in USA?
It's been like more than 12 years now.
Software engineer?
Yeah, I'm software engineer.
Good. Best of luck. Okay. Tell me the question.
So the question is on the myopia side. So recently we started seeing myopia in younger kids, right? So maybe is it due to the reason for this online classes because of this pandemic and all those things, right? So what is your suggestion? Like how do we prevent myopia in younger kids, like from 6 to 12 years age?
Myopia, actually, it is not directly related with the electronic gadget viewing, directly, 100%. But what happens because of eye strain, hidden, might be the patient was having the underlying myopia, underlying minus power in his body, in her body, in younger age group, because of overwork, overstrain, might be little bit of increase of the power or appearance of the power which was hidden. Directly it is not affecting, but 100% the question is best, don't allow the children to be in front of laptop or online classes. Encourage them to play outside, encourage them to study by reading books. Reading is through the books is very, very comfortable to the eye compared to the e-books, because the font size, that rays emission from the computer or laptop, they are not so good, not proved to be good to the eyes compared to the books and all, because we are not so much concentrating over the books while reading. Our eyes will be moving here and there and all. Eyes are relaxing, but we have to concentrate, we have to see, because font size, screen size, and it will move off, it will be fading within seconds and all. Those things are really troublesome to the children, and that is because of pandemic. Underlying myopics came out to the ophthalmologist once we opened our clinic. So plenty students came to the hospitals with glasses, with correctable refractive errors. And definitely that was happened. That is there, but not proved.
Okay.
It's better to avoid. Yes.
Yeah. And the follow-up question is, you said like with the LASIK treatment, you can correct all these myopia issues, right?
Yeah.
So is it advisable for younger kids also? Or is there an age limit for that?
Yeah, definitely. It was the best question. Age limit is there. Starting from 16 to 25, it's the best age group for the children to be younger individual to go for LASIK. LASIK is, we can correct, I told you, -8 to -10 is the best limit. Beyond that, we can't allow them for the LASIK to be put, because it is a corneal manipulating procedure where the corneal thickness should be healthy, normal, what the surgeon requires. And below the 16, because of changing the refractive error. Refractive error, you know, that is -3, -2, -4. As the baby or a boy grows, his eyeball, anterior, posterior development of the eyeball also varies. So the myopic refractive error will also vary. It won't fix. Surgeon cannot fix his refractive error -5 or -6. How can he fix his power and do the LASIK treatment? If once it is fixed and once the surgery is done, that he will have the normal vision for -6. But next year, if there is the increment in the power to the patient, once again, that is the side effect of LASIK. Once again, they have to go for repeat LASIK. That is the one disadvantage. So it is better to have after 18 to 25 or 26 like that. Beyond that, if the other conditions of the patients are permitting, the surgeon will take the decision. But not below 16 or 15. So many patients are really interested to have the LASIK in the younger individual, younger age group. Better avoid LASIK less than 16.
Thank you very much, ma'am.
Okay, thank you.
Any more questions or?
One thing, Anita, I did not mention about the smoking and alcohol. Smoking and the trend of young generation is alcohol. Party drinks is permitted. Even elders also permitting party drinks. These are for addiction. Alcohol and smoking are known to proved they are for addiction. Eating something is not addiction. Eating some groundnuts and all, it's not an addiction. But these things produce the addiction. And addiction, who knows what level they are drinking. It might be this much is sufficient for one person, this much is sufficient for another person. That alcohol amblyopia, tobacco amblyopias are very, very known things. Always the drinks may not be good to all because costly drinks may not be available to everybody. And so many villagers are losing their vision with bad quality, low quality, fermented alcohol, old, very bad alcohol. Might have heard very bad words about such things. Early morning or after 1 week of having the bad alcohol, how their liver, how their kidneys are damaging. They will have amblyopias of the optic nerve, uncorrectable vision loss because of tobacco amblyopia. And alcohol also very bad. And the vision, the compliance, you might have heard the recovery rate for any problem in the body, they are less in diabetic, in hypertensive, in alcoholics, in smokers, and who are suffering from radiotherapy, chemotherapy, immune compromise, immune suppressants and so on. Their compliance, that is the recovery rate or threshold rate are less. That one amongst them is smoking and alcohol. So better avoid these bad habits. Have good green leafy vegetables. Good green leafy vegetables. Plenty of water, drinking water, and fresh fruits. And oil. Avoid the oils. Fat, oil, and thick milk, thick curd, butter, ghee. Avoid as much as possible. For children, I am not telling. Only aged after 35, 40 years, I am telling. These will put on the weight. Bad cholesterol will be more. So we have to struggle a lot to reduce the weight. We have to fight against so many preventable diseases in future. Worry about the future. How we are worried about the future where people are making that property, this property. So worry about the future. If you suffer, if you end up in complications of a disease, avoid such complications, such diseases as much as possible. Try to be happy with good food, which are available in our surrounding. Fresh leaf vegetables, green leaf vegetables, plenty. Tea. Tatte tumba tarakari. Our yoga teacher used to tell me, tatte tumba tarakari. You have a plate with 1/4 rice or pulses, 1/4 fruits, 1/4 vegetables, or 1/4 once again fruit or vegetables, and plenty of water. Really, you will be satisfied with such amount of food. Telling is so easy, following will be difficult, but just knowledge is very important. What we are, just that idea of guilt is very important. Eating 3 times ice cream, 3 times pizza, 3 times processed food or outside food and all with fatty food, paneer, that thing, cheese and all. That idea should have, that guiltiness should be there. 3 times I am having, it's not good. 3 times a day eating sweets and all, it is not good. That health awareness is very important. And health awareness in the society, that's what, speak out. If family members are having any diabetic problem, just to spread such good knowledge to the others who are having diabetes of your friend and all, make them aware. Go for checkup, regular checkup and all, eye checkup, frequent changes of glasses and all, or surgery. Don't make them fear about the surgeries and all. And doctor is advised to wear the glass, wear it, don't avoid the glasses and all. This complication, this is health awareness spread of knowledge regarding the such camps, such talks are really helpful to society. Whatever the knowledge the people have, they may not be sufficient, because bad things they will spread. Why to go for vaccination and all? Corona vaccine, they were not taking only corona vaccine. Now we are in the list for 4th vaccination. Medical fraternities are taking in the 4th, waiting for the 4th vaccination. So many, we used to call them, we used to invite them all, we used to tell all patients, come and take, go, can get the vaccination. So bad things will be spreading like wildfire. Good things, such good things, awareness about the health and all, spread such news to the people. Don't make them to fear about the disease. Just education of the regarding the health and the eyes. What else?
Thank you very much, Doctor, for giving such a good GAN of all eye diseases, covering from young to the old age group people. Right now, because of the time, I think though we are all interested, because of the time we have to wind up the session. So let me request Mr. Praveen Bodkeji to give vote of thanks. Praveen.
Before giving vote of
you.
thanks, sir, before giving the vote of thanks, I want to say thanks to whole BVI team of national level, Tatuskar sir, Satish sir, and KV Rao sir, and floating club. Really, I am much fascinated and interested in floating club. Anita is running it as a MC and all today. That's very beautiful group of this floating club. Attractive club. Really, I think international people are also joining here. So I really am happy to see the people from USA, Dubai, those people sitting at Shimoga in Karnataka. I am getting in touch with our Bhavsar own people in so high position and all. See, really, I am happy to be the part of this BVI floating. Thank you, Anita. Once again, very thanks to you for giving me an opportunity to speak little bit about the eye problem. Thank you, Anita. And thank you, whole BVI, and thank you, whole floating club.
Thank you, Ji. I would like to extend our thanks to Srimati Bharati Chandrakanth Ji. Such a soothing and such a informative session. Like how a mother talks to their children, how a sister talks to their brother, right? I really like this, the way that you conducted the session. I mean, telling the importance of the health, telling that prevention is better than cure, and doing lots of social services, going to temples and giving, free eye checkup sessions. You are very inspirational to us, Srimati Bharati ji. And again, the importance of food, computers, gadgets usage, outdoor playing, every minute details you have covered. This is really impressive. And also you stressed on the yearly checkups, because a lot of people doesn't know that they have to go for yearly checkups.
Yes.
To recognize the problems in early stages, right? So that is also very well received. Thank you very much, Ji. And moving on, I would like to extend our thanks to Savita Ratnakar Ji for taking the Gayathri Mantra and making the event more divinity. And to our founder, sir, and our young and dynamic president, Mr. Satish Jadhav Ji, and Gajendranath Malode Ji, Shashi Suresh Ji, we would like to extend our thanks to you all for continuous support you have been giving. throughout the journey of BVI Floating Club. Mr. Manohar, President of Floating Club, I would like to thank for your welcome speech. The main pillar of this wellness session, Srimati Anita Sarvadeji, she's from the beginning. She's talking to the Srimati Bharati ji, talking to a lot of other folks, and bringing all the peoples on the board. Really well deserved task you have taken, Anita ji. Thank you very much. And to all board members, BVI dignitaries, and all the participants, we would like to extend our thankful to you all. And we'll end the session after this. Anita ji, over to you.
Thank you, everyone, for attending the wonderful session, and all of you have a nice weekend. Thank you, everyone. And the session is recorded, and for the people who were not able to attend for this time duration, I think they will make use of it. And it is a very good session. Thank you, Bharti, for providing such a very good session. Thank you.